This is a public service announcement for malaria in Africa. This announcement is sponsored by the Department of Public Health. Malaria is a life-threatening disease that is affecting millions of individuals around the world. Malaria is caused by the Plasmodium parasites that are carried by the female Anopheles mosquito. In 2017, there were a reported 219 million cases of malaria in 87 countries around the world. In 2017 alone, it is reported that malaria claimed approximately 435,000 lives worldwide. Malaria transmission. There are essentially four means by which malaria can be transmitted. First, there's a mosquito-borne malaria. This is where an individual comes into direct contact with a malaria-infected mosquito, where that individual is bitten. Second, there's an airport malaria. This is where a malaria-infected mosquito is transmitted by aircraft from a malaria-endemic country to a non-malaria endemic country. Third, there's congenital malaria, when a malaria-infected mother passes the disease to her child during pregnancy. And finally, there's transfusion or transmitted malaria, when malaria-infected blood is transfused to a healthy individual. Some of the symptoms of malaria include fever, chills, headaches, nausea and vomiting, muscle pain, fatigue, sweating, chest and abdominal pain, and coughs. Malaria treatment. Malaria is treated with prescription medication over a certain course of time, which will be determined by the type of malaria parasite an individual is infected with, the severity of that individual's symptoms, that individual's age, and whether that individual is pregnant or not. Prevention method. Malaria can be prevented using the ABC approach. First, awareness of risk, knowing if you're at risk based on where you reside. Second, bite prevention. Avoid being bitten by the use of mosquito repellent, mosquitoes, nets, etc. Third, check for malaria prevention tablets. Ensure you are taking the correct medication with the correct dose and that all medication courses are taken completely. And finally, diagnosis. If you think you are infected, seek help as soon as possible from your medical provider. Once again, this has been a public service announcement for malaria in Africa. This announcement was sponsored by the Department of Public Health. Thank you.